So of course you know it takes longer to become a doctor versus a PA. But years later, after your training, once you start working in the emergency room as a doctor or a PA, how similar or different is it? So I'm a PA and I've been working in the ER for about 10 years. And so naturally I've worked with many, many physicians in the ER because we kind of work with a different one every single day, every single shift that we're there. Kind of depends on where you work. But so I've seen what it's like for them. I've seen what it's like for me, obviously. And I'm going to talk about those similarities and differences. What's the same? What's different? What could be better for the doctors? What could be better for the PAs and vice versa? I'm going to break it down by 5 categories. So 5 main categories. And those are, what are the responsibilities like, the income, the procedural skills, the leadership or decision-making opportunities, and the prestige. So let's go ahead and get into it. Differences and similarities as a PA versus a doctor in the ER. So first, what are our responsibilities like in the ER as a doctor or as a PA? Well, first of all, there's all the usual stuff that comes into the ER, right? People that are not dying necessarily right then, but they have some type of chief complaint, some type of issue that they're there for right then. Do you know what the most common chief complaints are in the ER? It's abdominal pain, chest pain, shortness of breath, and then it's like fever and headache and a bunch of other stuff. But there's those really common ones, right? So let's just take abdominal pain, for example. So people come in with abdominal pain. Is there any difference between what I do or what a doctor does when I see them and evaluate them and order tests? No, there's absolutely no difference. And in regard to abdominal pain, we have a pretty similar knowledge base and similar skill level in terms of your routine run-of-the-mill abdominal pain patient. In other words, they know what to order, I know what to order. They know what to do depending on the test results, I know what to do depending on the test results. So it's basically we're doing the same thing, we have the same responsibility, do the same thing. The same thing would be kind of true for, say, chest pain, for example. Again, if we're talking about someone who's not on the brink of death and needs an immediate intubation or something like that, that's kind of a different scenario. So for all these kind of routine ER stuff, which is the bulk of the patients we see, we have similar responsibilities and do similar things. Now, what about the sicker patients, the more serious cases, et cetera, et cetera? One difference where I work that's almost like a protocol difference is that when there's a patient, when there's a code, usually the physicians are the one running the code. And what do I mean by codes? Well, we have our code whites, which are the strokes. We have our code STEMI, which are heart attacks, and then patients who are coding, which means, their heart stopped or something to that effect. So pretty much where I work, it's always the physicians that'll take those cases and be in charge of those cases, except if there's an extreme circumstance, like I used to do night shifts, and there'd only be one doctor and one PA. And so if the doctor was off upstairs dealing with some other serious patient on the floors, then maybe I would be stuck running a code or something like that. So occasionally there are exceptions, but most of the time they're running the code. So they kind of are more responsible for some of those more serious cases in the ER. That being said, this will vary depending on where you work, what region, what hospital, et cetera, but that's just kind of how it's been in places that I've worked. All right, let's move on from responsibilities to income. What about income? Well, this one's pretty easy to break down. Basically, ballpark. Physicians make something like 3x what a PA will make in the ER, roughly 3 times as much money for sometimes doing the same job, like I was saying earlier, for those routine run-of-the-mill patients, but sometimes not doing exactly the same job, as I alluded to and as I'll talk more about. So they make about 3 times as much. Now, where I work, I'm paid hourly, but they kind of get a bonus if they see more patients. In other places, it could be the PA who gets that bonus also for seeing more patients. So, so that just depends on where you work. But ballpark-ish, it's something like 3x income. Let's move on to procedural skills. This one's kind of interesting. So what kind of procedures do you do in the ED? Well, there's a whole long list. And that's one of the cool things about this specialty is that we do lots of hands-on procedures. Now, there are the so-called advanced procedures. I'm just kind of using that as a vague general category. But that's things like intubating a patient where you stick a tube into their lungs, or where you put in a central line, or put in something like a chest tube where you have to put a tube like into the space between their lungs and like the wall of their thorax, that sort of thing. So those are kind of advanced procedures. And where I've worked, the physicians just about always are the ones doing those procedures. So that's one difference. And so I don't really get reps with those things, and I wouldn't really feel comfortable doing those things. Now, I've talked to other PAs who work in other places who have a lot of experience, or maybe they worked as a paramedic before, and so they got a bunch of experience doing the intubation, for example. Or they work in a different hospital, and then they just do that routinely. So it depends on where you work. It depends on your background, but certainly there are a lot of places kind of like where I work where the physicians tend to do those things more often. But what about other procedures? So we do a lot of other procedures too, like suturing lacerations or doing an incision and drainage on an abscess where you cut open a pus pocket, and other things, draining other types of abscesses like a peritonsillar abscess in your throat, stuff like that. So at my first job, some of the time I would work in the fast track, and I would end up doing a lot of those procedures, like different types of lacerations and abscesses and so on and so forth. I also got a lot of experience doing detailed eye exams and sometimes taking foreign bodies out of the eye and stuff like that. So there have been times in my career where it's been apparent that I had more skill and experience with those types of procedures than some of the doctors that I was working with. Not all of the doctors that I was working with, but at certain times in certain situations, it was apparent that I either knew a little bit more about it or had more experience or had more skill with one of those types of procedures. And so sometimes that happens because a lot of times your skill level with those types of procedures is just based on what you've been exposed to and some of the training that you've got. So there's the advanced procedures and maybe the less advanced procedures. Sometimes the doctors are better at certain things, particularly advanced procedures, because they get more experience, more practice, more training. But sometimes the PAs are better at certain procedures as well, like the lacerations, like I mentioned. Not in every case, obviously, but just depending on who's involved. So what about leadership and decision-making and things like that? Well, pretty much the doctors have the higher up kind of leadership positions, like being the ED director. And in my group, of course, like some of the physicians are the ones that are kind of making more of the decisions for our group as a whole about how we handle things and even about pay related things. So the physicians definitely have more leadership opportunities and are able to get more involved in decision making and things like that. All right. So what about prestige? Do doctors in the ED have more prestige than PAs? Well, broadly speaking, yes, of course, because, doctors just have quite a bit of prestige in general, and PAs don't have as much, partly because people don't really know who we are half the time. So if people really understand who we are, then we have a pretty good amount of prestige too. But some people just have no clue what a PA is still, even to this day, even though our career has been around quite a while now. So why does this matter? Well, it just affects how people treat you and kind of your interaction with other staff, and not to mention the pay and stuff that I alluded to earlier, but is kind of indirectly related to prestige. Now, things that happen in the ER, even as a PA, you introduce yourself as a PA, but then the patient might later call you, well, doc, what do you think, doc? They might call you doc, as if you're a doctor. And then no, you're not, and you didn't say you were, but that still happens. So sometimes you're kind of treated the same as the doctor in that type of situation. Occasionally the opposite happens where there's a patient or someone else who kind of talks down to you because you're a PA and not a doctor. Occasionally a patient kind of acts like they're mad that, like, hey, why am I seeing you instead of a doctor? And that's usually either because they don't understand the differences and similarities, or they have some other kind of issue going on, like they're maybe trying to get more narcotics or whatever. So various possibilities, but all those different things happen at different times. So you kind of just let it roll off your shoulder, or, go with the flow more or less. So those were some of the similarities and differences between doctors and PAs in the ED. And if you want to know about 5 potential advantages of being a PA over a doctor in general, not just in the ED, I've got a video here that explains 5 of those. And if you want to learn a little bit about the differences between PAs and nurse practitioners, I've got another video that goes over that. And that talks a little bit about what the differences and similarities are in the emergency room as well, since that's where I have the most experience. Thanks for watching. I'll catch you next time.